March is Colorectal Cancer Awareness Month, and colorectal cancer is one of the leading causes of cancer-related deaths in the US, but it's also one of the most treatable cancers if detected early. How can you prevent it or reduce your risk? We're here with Dr. Andy Menshaw with CU Medicine Gastroenterology in Highlands Ranch. Thanks for joining us.
You're welcome. Thanks for having me.
So first, Dr. Menshaw, when talking about minimizing risk for colon cancer, number one thing you can do is get tested, get a screening, a colonoscopy. But when should people start getting those regular colon cancer screenings?
Well, traditionally it's been age 50, and more recently there's been a push to drop it to age 45. So some insurances will pay for age 45, and that's for people that don't have a family history. So if you do have a family history, like a first-degree relative, especially who has colon cancer, then you should start at age 40 or maybe sooner, depending on when they were diagnosed.
How often, if you start at age 45, age 50, how often are you needing to go get a colonoscopy?
Well, if you don't have any polyps and you don't have a family history, it's every 10 years. But if you do have one or two small polyps, it's either 5 to 7 years. But if you have larger polyps or many polyps, then it becomes more frequent.
But talk about what a polyp means. If someone's told they have a polyp, is that cancerous?
It's a little growth. So it's like a bump on the lining of the colon. And as they get bigger, they can look almost like a mushroom. But they're generally 3, 4, 5 millimeters in size, so very small, and they can be removed easily with a scope. It takes about 10 years for a little polyp to grow into cancer.
I think many people think colonoscopies are intimidating, might be a little scared or nervous about it. What does the procedure entail for someone that's never had one?
So the probably the hardest part is the prep. So the day before, we have you just on a clear liquid diet, and then you drink. There's a variety of options available, but basically they flush out your colon, give you diarrhea that's temporary, and then the next morning you have someone drive you in, because we give you sedation. So you get an IV that's put in, and we have an anesthesia provider that takes care of the sedation, so you're asleep and comfortable. Usually the procedure is about 20-30 minutes at the most. And
you mentioned the prep. We were talking a little bit about this before. Has that improved over the years? What is it exactly?
It has. So it's now we do a split prep. So you drink half the prep in the evening the night before, and then half in the early morning of the procedure. And that it's easier to drink. It also cleans your colon out better.
In addition to a colonoscopy and testing and screening for colon cancer, what are some other things people can do to reduce their risk?
So the big ones that really increase your risk are obesity, tobacco, so smoking, and alcohol. So there's some data that increasing fruits and vegetables in your diet lowers your risk.
What are some symptoms that people should be on the lookout for colon cancer? Are there any early symptoms that would tell someone they might have it?
Early, generally people don't have symptoms. There's really no symptoms that are totally specific for colon cancer, so we have to be careful. But bleeding is usually from hemorrhoids, but it could be from a cancer. A change in your bowel habits, like getting more constipated or having more diarrhea, can be a sign as well. Just being aware and thinking about your family history is really important, and in some kind of screening. It doesn't have to be colonoscopy, but it definitely, it's the best test, because we can prevent cancer in the future.